Okay, today we would start the topic of thoracic vertebrae. As you know, thoracic vertebrae are 12 thoracic vertebrae. Thoracic vertebrae are 12 thoracic vertebrae. Now, from thoracic vertebrae T1 to T8, which has a common structure, and T1, T9, T10, T11, and T12 have some different structures which are not present in the common, which are from T1 to T8, which are not present. These have different extra features which I would tell. Extra features. Okay. Now, first of all, we would see the articulation facets and all those things. Commonest feature of thoracic vertebrae. Thoracic vertebrae, common feature. It has costal facet. It has costal facet, which is upper and lower both. Why costal facet? To articulate with the ribs, head of ribs. These articular facets are at the junction of body and pedicle. Okay. Now, as I told, pedicle and body, where it is in the cervical vertebrae also. So these facets are located at the junction of body and pedicle. At the junction of body and pedicle. These facets articulate with the head of ribs. Obviously, thoracic vertebrae, there is articulation of the ribs, which makes a thoracic cage. From posterior side, it articulates with the thoracic ribs, thoracic vertebrae. Sorry. Now, another facet which is common is called transverse process. Okay. Body and vertebral arc join to form a central foramen. Now, as I told in cervical vertebrae also, like anterior arc, anterior, it was in cervical vertebrae, but here body and vertebral arc. I would show you what is the vertebral arc. Wait a minute. This is a body. Okay. This is kind of a structure of vertebra. Now this arc is called as vertebral arc. And posterior lateral side has two facets, superior and inferior. Obviously, which we have seen in the cervical, it is same here, but few difference because of the position, because of the articulation, there are changes. Posterior lateral side has two facets, which is superior and inferior. Now these superior and inferior facets, inferior facet on vertebral joint, inferior facet of one vertebrae joins superior facet of another vertebrae. The site of articulation, a rib head is attached. Now see, this is a body. Okay. It is concave, like a base, inferior part of the body is concave. This is one vertebrae, and below that there is another vertebrae. In between this, intervertebral disc will be there obviously, but this is the another vertebrae. The superior part of the second vertebrae is concave. Okay. When these vertebrae joint each other, here by, wait, here is intervertebral disc. Okay, don't get confused. Now these join each other. Here are facets. Here are facets. here to articulate the head of the rib. But in few vertebrae, these facets are incomplete. Few have complete facet, and few vertebral bodies have no facet. Like in that also, there are superior and inferior. In superior part, it might be complete, it might be incomplete, it might be no facet. In inferior also, it might be complete, it might be incomplete, it might be no facet. Then now along the upper and lower border, the anterior and posterior surface is provided attachment with anterior and posterior longitudinal ligament. Along the upper and lower border, okay, the anterior and posterior surfaces has attachment of anterior and posterior longitudinal ligament, okay. From the below, the posterior surface of the body is marked by many foramen for basivertebral vein. Now if you see a real vertebrae, thoracic vertebrae, just observe it from posterior surface, like from below the posterior surface, below the posterior surface of body, there is a small minute foramina for basivertebral vein, okay. Now next is next we would see the complete costal facet for articulation of head, incomplete and semi facets. We would see, as I told you, first one, ninth one, 10th, 11th and 12th are different costal facet which it has. The first one, the first thoracic vertebrae has a complete costal facet for articulation with the head of first rib on superior part of posterolateral surface, superior part of posterior lateral surface, and semi-articular facet with the head of second rib on inferior side of the body. Do you get it? Now 10th thoracic vertebrae has one semifacet on superior edge, and 11th and 12th, which has one complete costal facet in middle of each lateral surface, okay. Again we would revise. First has two facet, complete costal facet on superior part, and one semi facet on inferior, okay. In 10th, it has one semi facet on superior edge. 11th and 12th, they have one complete in middle of each lateral surface. Okay, is it clear till here? Now transverse process of 12th thoracic vertebrae have on the posterior surface an accessory process and a mammillary process. Transverse process of 12th thoracic vertebrae. 12th thoracic vertebrae have a accessory process transverse process of 12th thoracic vertebrae have accessory process and mammillary process. Okay, till here we have seen all the simple characters of thoracic vertebrae, nothing extra into it. Whatever is similar in another vertebrae, it is same, but just we have to remember the another differentiations which make it different from another kind of bones.